In health news, the life expectancy for Americans is going up again following a 2-year dip because of the pandemic. And that longer life is putting pressure on health care providers. Joining us now with more on this is Stephen Ferrara, President of the American Association of Nurse Practitioners, who's in Nashville this week for a national convention. Stephen, first of all, welcome to Music City.
Yeah, thank you so much for having me. I'm here with 5,000 of my nurse practitioner colleagues and hundreds from Tennessee.
That's great. Glad to have you. Now, what role are you and those colleagues playing in the increasing need for primary health care here and across the country?
Yeah, absolutely. So nurse practitioners are responsible for over 1 billion patient visits annually in the U.S. We are there to provide primary health care to our patients and make sure that patients are getting the access to health care that they need to focus on health promotion and wellness, as in addition to disease prevention and taking care of their chronic conditions.
I went looking for numbers and found out that the Federal Bureau of Labor Statistics is predicting a need for another 100,000 nurse practitioners between now and 2032. My question is, are there training spots for all those people? And are those spots hard to fill, or is this a job people are lining up for?
Well, the nurse practitioner role has actually been named the U.S. News and World Report #1 job overall. So we're really excited to see the attention on the nurse practitioner role. Schools are competitive for nurse practitioner. So we want to make sure that there is a pipeline, a future workforce. We want to make sure that there is adequate faculty that can prepare these nurse practitioners of the future. So certainly we want to make sure that all of this is happening as we move forward. And, it can be a challenge. And that's why we're constantly looking for, additional support in these programs.
With more nurse practitioners out there providing care, I've read that there have been some issues getting insurance companies to properly reimburse you and your colleagues for value-based treatments. What are those, and is that still an issue?
It is still an issue. We have some bills that we focus on at the federal level that would help to ease some of those challenges, particularly with Medicare. So we have, bring attention to our lawmakers so that nurse practitioner provided care certainly gets the reimbursement that's required for the complexity of today's patients.
Sure, that's a tough job for GPs too. In your mind, is there actually a benefit with choosing a nurse practitioner? And these days, a lot of people can choose for primary care rather than trying to find a medical doctor who's still accepting new patients.
That's right. Access to care is critical for all individuals. And that's why we believe that nurse practitioners are a key solution to being able to provide essential access to care. And you did say choose nurse practitioners. And, we are wanting to make sure that the public is aware that they can choose a nurse practitioner for their healthcare provider. We certainly focus on the whole person. As we approach patient care, we want to make sure that we're dealing with not only physical health, but mental health that plays a huge role in how we feel overall. So we have a website, wechoosenps.org. And for those who want to find a nurse practitioner to provide their care, I would certainly encourage folks to utilize that website.
Great information. Stephen Ferrara, President of the National Association of Nurse Practitioners. Thanks very much for taking time to do this.
Thank you so much for having me.